A warm good evening to one and all. I am Dr. Anila Nair. So today we are here at our 5th Anubhava session. It is organized by Ayurveda Map and sponsored by Dr. P. Alikutti's Kottakkal Ayurveda Pharmacy. Dr. P. Alikutti's Kottakkal Ayurveda Pharmacy has been a part of its mother concern, Dr. P. Alikutti's Kottakkal Ayurveda and Modern Hospital since 1965. KAP manufactures around 400 classical products and 40 proprietary medicines in their GMP and ISO certified production units. They also develop ancient formulations into proprietary medicines after a series of tests and results-oriented studies in their R&D department with modernized laboratories. They have food and nutraceutical divisions that produces various types of dietary and nutritional supplements. If you need any further information regarding KAP, kindly contact Dr. Jasul. I'd once again like to welcome you all on behalf of Ayurveda Map. Ayurveda Map was started by a group of young doctors in the year 2016. It was officially inaugurated by Dr. P.M. Varya sir in the year 2017. Ayurveda Map started by conducting the in-hand practical sessions. We started with Marmayu, which was an intense training on the application of marmas, and along with that Marma Bandhas, which was a training program on the bandaging series. Then we had 3 sessions on Varnyam, which was a practical series in Ayurvedic cosmetic therapies. Then we had Medi Sujo, which is an awareness session on the Sujo therapy exclusively for medical professionals, followed by Agneya, which is a workshop on Agni Karmas, followed by Vistara. Vistara was for business development of medical professionals. We received warm and overwhelming responses to our sessions from our participants. Considering the COVID conditions, we continued our journey through online sessions. We started our online sessions from January 2020. We started again with Varnyam, which was about cosmetic therapies, followed by Bhrachaka, which was regarding Ayurveda dermatology. That was followed by Gala. It was regarding the management of thyroid diseases, followed by Prayana. Reorientation program for Ayurvedic students and young doctors to build their career in Ayurveda. We also had sessions on Kriti, which is about Ayurveda product making, and Dhyana, which was regarding therapeutic yoga sessions, and Nayana, which was a common eye disease management and Kriya Karmas. Then we had session on Vibha, which was session on cosmetic preparations, followed by Pushya, which was the first gynecological session, followed by Medas, which was regarding the management of obesity and diabetes. We then had session on Chipra, which was regarding the art of cupping, and followed by Raksha, which was a second series of gynecology, a series of Garbha Samskara and antenatal and postnatal care, followed by Varnya, again regarding the cosmetic therapies, and followed by Kshara, which was regarding the Kshara Karma. We have also started a new venture, it's Swadhyaya. It was to support the students academically. During the pandemic times, in this, we gave recorded classes, detailed notes, one-to-one doubt clearance, question paper and research articles discussions. Now, our upcoming session, it is regarding PG Diploma in Ayurveda Cosmetology. It is a 1-year online and offline course. Here, offline center is Calicut, Kerala. It is recognized by STED Council, which is Scientific and Technical Education Development Council, and it is organized by, again, Ayurveda Map. The features are online and offline classes will be there. There will be monthly minimum 4 live online classes and 4 offline classes and practical training at Calicut, Kerala. Case discussions will be held. We will cover all aspects of Ayurveda cosmetology and trichology. Ayurveda therapies and product making will be there, and treatment protocols will be explained. Classes will be held by handled by experts from various fields. Eligibility is BMS graduates and not applicable for internees. Now it is time for us to start our session. As I told, it is our 5th Anubhava series and it is a free webinar series. As you all know, today's topic is OP level practice of Vasthi. Our presenter is Dr. Rathi B. Unnithan. She has done her BMS and MD from Government Ayurveda College, Trivandrum. She has done her MD in Rasa Shastra and Bhaishaja Kalpana, and she joined ISM department and served for almost 28 years and retired as DMO. Presently, she is the CEO of Unnithan's Ayurveda College, Hospital and Research Center, Changanasheri. She has published many articles on Ayurveda in newspapers and health magazines. She has conducted classes on varying subjects, both for common masses and doctor community. With warm regards, I invite you, ma'am, to start the session. Over to you, ma'am.
Good morning to all. Today's our topic is OP level Vasthi Karma. It's a part of Anubhava series, which is an online education program of Ayurvedic Map. I take this opportunity to thank Dr. Jesul and team Ayurveda Map for giving me this opportunity. I also wish to thank the sponsor of this program, Dr. P. Alikuti Kottakkal Ayurveda Pharmacy. I would like to express my sincere pranams to all of my gurus. We can start. Om Ganeshaya Namah. Am I audible? Are you able to see the slides? Am I audible? Dr. Jesul or Dr. Anila?
Yes,
can you hear?
Yes, ma'am. Yes, ma'am. We can hear you.
Sri Dhanvantari Namah. Let us start with OP level practice of Vasthi. Vasthi therapy is one of the most important therapeutic procedure among Ayurvedic Panchakarma. Sarva Upakramanam Pradhanatam, because it regulates Vata, the predominant dosha. Viryena Vastiradattan doshan Apadamastagan. Apadamastagan doshan. Vasthi is doing karma with the doshas, expulsion, alleviating the doshas and evacuating through the rectal cavity. Aneka karma karatvat nanavida dravyanam samyoga samshodhana samsamana sangrahanani. These are the properties of the Vasthi karma. It is shikra brahmana karitvat vikrida anila ubachchedatva. These are the reasons for becoming most important therapeutic procedure in Ayurveda. It is also considered as Artha Chikitsa. Vasthi is done in Anila Pradhaneshu Dosheshu. It is named so called because Vastina Diyade and Vastira Anyudyade. Vasthi Vadeja, Pitteja, Kafe, Rekteja Chasvide.
Ma'am.
Hello, ma'am.
Ma'am, it's not, ma'am. Ma'am.
Hello, ma'am. It's not audible.
Not audible, doctor?
Yes, yes.
Yes, now
right.
it is fine.
Say much louder.
Yeah.
Vasthi classified into 3 types as per Charaka Samhita. Am I audible?
Yes, ma'am. Yes, ma'am.
Dr. Jesu?
Yes, it is audible.
First one, Anuvasana Vasthi, Niruha Vasthi, and Uttara Vasthi. Anuvasana Vasthi is Sneha Vasthi, Uttara Vasthi is a variety of Sneha Vasthi, and Niruha Vasthi is otherwise called Asthavana Vasthi. It is named Niruha because of the Uhadida Virya Pravati. Asthavana because it is Vayasthavana. Asthavana Vasthi is classified as Utkleshanam, Samshodhanam, Samshamanam, Lenkanam, Brimhanam, Pichavasti, and Mathudaili. These names denote its properties and the usage. Mathudaili. Mathudailiyam is named so because the prime ingredients of this Vasthi is Mathu and Taila. Mathu Taila Pradhanitvam. Synonyms of this Mathudailiya Vasthi is Yapanam because it helps to Yapana or helps to sustain. Yuktaratha. Yuktaratha is the another synonym. Yuktaratha is named so called because it acts like a car which is ready to travel for alleviation of roga. In case of Yuktaratha Vasthi, there is a Madandara also. In Susruta Samhita, Susruta says that this Yuktaratha is a name because the patient can travel after having Vasthi on Detha or Hasti. Some of the doctors are also practicing this Yuktaratha Vasthi and they are sending patients on scooter, car, etc. Then Doshahara Vasthi. Doshahara Vasthi is named so because of the Dosha Shodhanatva. Siddha Vasthi, which gives assured result. These all are synonyms of Mathudailiya Vasthi. I placed it here for just for the knowledge. Susruta classified Vasthi into two types. One, Niruha Vasthi or Asthabana Vasthi. Second, Snehika Vasthi or Anuvasana Vasthi. What's the difference between this Anuvasana Vasthi and Asthabana Vasthi? One, Anuvasana is contains Snehadravya and Asthabana is otherwise called Kashaya Dravyas. It contains Kashaya, Sneha, salt, Kalka, etc. But this Anuvasana is done in Vritti of Vayu and this Asthabana is done in Vaigunya of Vayu. Then there's another question. Can we perform Vasthi Karma at OP level? Are you scared to perform Vasthi? You are clean. I know that some of the doctors are scared to do Vasthi in their OP level clean. Here it is Acharya Vachana. Vasthi Sukhatvat Bala Vrittha Krisha Stula Kshina Dhadu Indriyeshu. This is the reference from Ashtanga Hridaya Vasthi Vidhi. Acharya says that it is an easier procedure than Vamana and Virajana. Vasthi Sukhatva. It does not produce klesha. That is why he has written Vasthi Sukhatva. Like Vamana and Virajana, there is no restriction of age to Vasthi.
Ma'am? Ma'am? It is not audible, ma'am.
I will repeat. Vasthi Sukhatva. Am I audible?
Yes, ma'am.
Doctor?
Yes,
Can
ma'am.
you hear, doctor?
Yes, ma'am.
I will repeat. Vasthi Sukhatva Bala Vrittha Krisha Stula Kshina Dhadu Indriyeshu. This is said by Ashtanga Sangrihakara. Acharya said that Vasthi is an easier procedure. That is why he has written Vasthi Sukhatva. It is easier than Vamana and Virajana. It will not produce any type of klesha. There is no restriction according to the age. Vasthi is suitable in all age groups. Ajanma Marnam Shastam. Vasthi produces Vadhanilomana, Agnidibana, it is Vayastavana, it is Rasayana and Vajigarna. It produces Pushti, Ojovarthana, Viryavarthana, and etc. Role of Vasthi as an OP level procedure. Vasthi is a result-oriented Panchakarma. Better relief Vasthi gives better relief in acute conditions. If a patient is approaching us with Kadigraha, if we are able to do a Vasthi, it will give sure and certain relief from his pain.
Ma'am? Ma'am? Ma'am, it is not audible, ma'am.
Facilities, very few in Ayurveda. What is doctor? Dr. Anila, am I audible?
Yes, ma'am. Right now it is fine. In between it is breaking, ma'am. In between the voice is breaking. Now it is fine, ma'am.
Okay. It can be judiciously used if Vasthi is used and popularized in OP. What's the reason behind our fear? This is my opinion. The reason behind, I find out 3 reasons behind the fear of doing OP level Vasthi. One is the fear about retention of Vasthi Dravyas. Surely there will be a retention. There is chances for retention, but it can be overcome by various methods. One method is using Tikshna Vasthi containing Gomutra, Kshara, Saindava, Vaishwanara Churna, Dhanyamla, etc. The other method is by introducing a tube, we can push the Vasthi back. Or otherwise, use a catheter or syringe and it is to be introduced and pushing back. Then by the Vasthi is releasing and the Divya is released. These are the methods to overcome the fear of retention. The second one is death. Incidence of death is very few. Very few number of cases are reported throughout Kerala. Death can be prevented by taking precautions, adhering to guidelines, careful observations, and keen attention and timely intervention. Other complications are due to the negligence of people, human errors in various stages of procedure. These are the 3 reasons I can find out. Other complications are Netra Dosha. I have placed here just for knowledge sharing. All doctors know about this Vasthi Netra Dosha and its Vyapat, etc. etc. I am skipping this slide. Then Pudaga Dosha. Pudaga Dosha is also a human error or a by chance error. By chance error. Here also the Pudaga Dosha is placed. This is also for just for knowledge sharing. I am skipping this slide. Everybody knows about it. What are the precautions do we need to take for the proper usage of Vasthi? What are to be arranged? The most important thing is careful care taking, covering all aspects of Yogi and Yogabala. People are approaching us with Kadigraha, pain, sciatica, etc. But the doctor should ascertain that there is only one condition. There are chances of one or more conditions at the same time. Likewise, most of the people having comorbidities also. We should be aware of all these things related to Yogi. If a Kadigrahi yogi approaches for the Panchakarma treatment, in our examination, he is fit to do Vasthi. But if he is a Madhumehi, he is no, the Vasthi is not advisable. Doctor should take care to avoid such type of errors. Ensuring whether the patient is suitable for the procedure. The third one is selection of suitable yoga. This is the most important. If we are doing Vasthi using Pippali or Tishna Devyas in a Pitta Pragati, we should aware that it will not do no harm for the patient, or arrange or mix other suitable devyas to that yoga to avoid complications. Likewise, Vasthi, the size of the Vasthi should be selected. In our text, there are description about the Vasthi according to age. But in our market, these type of Vasthi are not available. Then please select or make the Vasthi according to the age. I used to do Vasthi with this fountain pen tubes in young age instead of these metallic Vasthi. Nowadays, Vasthi different size. The disposable Vasthi is available. Only the problem is the disposal of this Vasthi. Waste management is the problem due to this disposable Vasthi. Even though there is existing a problem with the different size of Vasthi. Then follow standard preparations of Vasthi Yoga. When we are taking a Vasthi Yoga, we should assess the medicine or ingredients are not altered, and the medicine and ingredients are of best quality. There, by taking these devyas, the patient doesn't face more abnormalities or face complication. That is, likewise, fix the standard of this Vasthi Devya. The fifth one is proper administration of Vasthi Devya. This is done by doing correct procedure. And the sixth one is practice of Vasthi considering Ritu. In Varsha, Sharat, and Grishma Kala, Acharya says that nighttime Vasthi is prepared. But in our hospitals, we are doing Vasthi at daytime. Then Agni, Koshta, Dosha, and Dehabala should be vigilantly assessed. Step-by-step verification of Purva, Pradhana, and Pastas karmas are very important. Follow proper Ahara Vihara before and after performing Vasthi. Anticipate the complication. How will we overcome if any instances will happen? There will be a plan. Plan A and B with us always to overcome this complication, and a plan, proper plan, and proper collection of materials and medicines to overcome the complications. Remember that when patient is in our clinic, during procedure, physician can manage even the minute problems and very well administer Vasthi in OP. Physician can well manage complications after the procedure also, even at OP level. We have a well-trained team to support us. But during journey and at home, patient is beyond our control. We are not able to manage problems caused by their carelessness, either in food pattern or lifestyle. In my knowledge, this is the only risk of doing Vasthi at OP level. Why? The procedures done in IPs are more safer than that performed in OPD. Preparations of Vasthis we are doing in IP and OP are same. In IPD, patients are under our direct control and observation, and hence there is less chance for post-complication and risk. Maintaining privacy of patients in our center. This is also an important thing. Otherwise, it will cause a lot of medico-legal problems. Privacy for changing trust. To avoiding medico-legal cases. Which are the factors to be focused and thoroughly concentrated while doing Vasthi? First one is Ahara. Ahara has an
Hello, ma'am. Hello. Hello, ma'am.
these are the areas to be focused.
Hello, ma'am. Can you?
Hello.
Yes. Please start from the Ahara. In between, we can't hear you.
Hello. Start
Hello.
from Ahara.
Yes,
Yeah,
yes. We couldn't hear you at that time.
Okay, okay. I will repeat.
Maybe some audio issues. Okay.
Ahara and Vihara. Proper usage of Ahara and Vihara before and after Vasthi is the most important thing. Otherwise, it will cause a lot of problems for the patient. The mode of the transport is also important. Selection of yogas for Vasthi, quantity to be administered, Yogya and Ayogya of patients to be selected are also important things to manage. In post procedure, diet, work, exercise, mode of journey to home, the non-availability of medicines at home, etc. can create problems. Then we can go to the indication of fasting. Everybody knows the indication in Ashtanga Sutra, Gulma Anaha Kuda, Malavada Mutra, Suprasanga, Sanyakshaya, Atmana, Adisara, Plehadosha, Jora, Shirashula, Pradishaya are the indications given in our text. Contraindications. Adisniktha, Alpagni, Adikrisha, Phukta Bhakta, Vamita, Vigrada, immediately after Nasya, Nishtivana, Shwasa Hika, Betha Gudodara, Chidra Gudodara, Degodara, Kushta, Madhumeha, Atmana, Amadisara, Kshatakshina, Alpavarcha, Alpaprajada. These all type of people are contraindicated to perform Vasthi. This is another contraindication seen in my clinical practice. In benign prostate hyperplasia or oversized prostate, Vasthi is contraindicated. It will facilitate the retention of Vasthi and cause many problems for the patient. Like any lesion or tumor compressing the rectum and sigmoidal colon, fibroid uterus with adhesion, large pile masses, these all are in all these cases, there is chances of retention and the associated problems. So please conduct a rectal examination and palpation of the patient. It is essential for good performance of the Vasthi. Adura Parisha before giving Vasthi. Detailed examination of dosha, Aushada, Desha, Kala, Salmya, Agni, Sattva, Oga, Bela. These all are much important to obtain significant result. Golden rules. These are the golden rules regarding Vasthi. First one is diet. Diet plays an important role before doing Vasthi and after performing Vasthi. Atra Puktavan Nandiruha, who had meals, the person who had meals, he is not advisable to do Niruha Vasthi. Pukta Eva Anvasya, the person who had his meals, he is Yogya for Anivasana. Any type of intake of food and water can alter proper functioning of digestive system, affecting Agni and Anila. Efficacy of this procedure depend upon Koshtasthiti. Rikta Koshtasya Anivasanam Urtam Prayadi Tena Vayo Jayamnasya. In Rikta Koshta Anivasanam Urtam Prayadi. We are doing Anivasanam at rectal area Pakvasya. If there is no food in his stomach, the Vasthi Deva is going upward and it causes Agni Mandya. Sadhyo Asida Ahara. Sadhyo Asida Ahara is indication of Anivasana. When Ahara is present in Amasya, then Amasya is blocked, and Vasthi should not be going upwards, and Sneha retains in Pakvasya, and it will help to alleviate the dosha, Vada dosha at its Vadasthana. Amasya is Taphasthana, Pachimanasya is Pittasthana, and Pakvasya is the Vadasthana. These three important sthanas of Tridosha are related to Mahasodas. Harmonious function of Tridoshas helps to maintain Agni. Action of Vasthi is related to gut-brain theory, and it is interrelated. The proper functioning of Mahasodas, Koshta, and Agni, these all are proper, then we will get good result. Otherwise, complication will be occurring. This is the role of Ahara regarding Vasthi. Guru, Apishanti, Vidahi, Adiushna, and Shida Aharas. Please avoid these Aharas, or it will cause problem, break the harmony of these sthanas and tridoshas, and entire metabolism will be deranged. This is an experience. One of my patients carelessly took vegetable noodles as diet in evening after Madhudeliya Vasthi, considering as light vegetable diet. I advised to take when he is hungry. He was in his home and he telephoned me as I am so hungry. I cannot suppress my hungriness. Then I advised to take light vegetable diet. Instead of taking light vegetable diet, he thought that noodles is a vegetable diet, which resulted in some of the complication. After 2 hours, gas retention, severe abdominal colic occurred, and I gave Varav Kashayam using Jeeraga. The Jeeraga is fried Jeeraga, a little Jeeraga, and pour 1 glass of water, and it will be reduced to half. With the Jeeraga, we are giving stick of coconut, Irkili, Pacha Malayalamil Irkili, Jeeragam, Nyet, Mavila Nyetta, Plavila Nyetta. These are the ingredients. These are fried, and 1 glass of water is added. Then it is reduced to half, and this is the filtered, and
Okay. Ma'am? Ma'am?
continuously. And there is cases in which abdominal colic was caused by this continuous sitting. Strenuous work. People who are doing strenuous work after performing Vasthi, Bellephremsia will occur. Daytime sleep is also contraindicated. By daytime sleep, kapha ulklashana will happen, followed by indigestion, and it will alter body mechanism. Precautions during travel and after Vasthi. This is my experience. Use private vehicles, use 3 or 4 wheeler as there is a chance for natural earth during journey. Do not allow self-drive. The distance to travel is, limit the distance to travel within 10 kilometers. Maximum travel time, half an hour. Avoid hilly and gut areas. Select straight road travel. Use maximum safe mode of the journey with less deaths. Complication with respect to quantity of Vasthi Divya. Large volume above 1 liter. For Raja Abhana Vasthi, the Adasha Prasada Vasthi, etc., the volume is large. It is very good. The result of administrating these Vasthis are very good comparing to other Vasthis. If it is when it is administered, there is chances for complication. When it is administered as OP level, IP level, it is safe. More potent Vasthis is administered like Eranda Muladi Vasthi. This is more potent and produces more result. Containing different type of Drivyas, there is chances for complication.
Hello, ma'am.
Ma'am.
Hello. Hello,
Ma'am.
ma'am.
For knowledge sharing.
Hello,
Then we
ma'am.
come to infrastructure of active doctor.
Yes. There is slight,
Anything, doctor? Anything?
yes, there is slight voice disturbance was there.
Okay, doctor.
Can you explain that previous 2 slides?
Okay.
Okay. Because the audio is suddenly drooping. Maybe are you using any headset or anything? Your computer audio itself.
Computer audio.
Okay. Yes. Back. No, not ma'am.
Complication with respect to quantity of Vasthi Dravya.
After that.
Yeah, ma'am. After that.
Doctor, this is textual knowledge. Sneha Vasthi quantity is 1/4 Niruha or 6 pala. Anivasana Vasthi quantity of half to Sneha Vasthi. Matra Vasthi minimum quantity Sneha half pala. We are usually administrating 60 ml. This is textual knowledge, but that is why I skipped these slides. According to dose of Vasthi, just written Dwadasha Prasadavati, Ekadasha Prasadavati, Basti, Nava Prasadavati, Ashta Prasadavati, Sapta Prasadavati. These are the various dosage forms of Vasthi. No need to explain. That is why I skipped these slides. Then classification according to number of Vasthis. These also are textual knowledge. Karma Vasthi contains 30 Vasthis, Kala Vasthi contains 50 Vasthis, and Yoga Vasthi contains 8 Vasthis. This is a size of Vasthi Netra, 1 to 6 year, Mudgavaha, size in Angula 6, 7 to 12 years, 8 Angulas, increases 1/3 per year. Kanayavaha, diameter of the top, 13 to 20 year, 12 Angula, Kola, Lendakuru size, Kola Astivaha, like so this, that is all we get from text. This is the infrastructure for OP level Vasthi. I just listed this for the help of the youngsters. Patient bed covered with rexin, attached toilet, chair, commode or bedpan, sterilized utensils for making kwatha, sieve or towel, large mortar and pestle or blender or mixer. We are using large mortar containing 1 liter, etc. For the mixture of the Vasthi. We are not using mixing for mixing the Vasthi. Sometimes if there is proper Vasthi Netra is available, we are using enema can with the tubes and using nozzles of different size. Vasthi Yandra with Netra, bags, commonly using plastic bags for filling Vasthi Dravya and strings. Now, the disposable Vasthi Yandra attached to plastic cover is freely available everywhere. Then facility for double boiling for Ushnamba Kumbi Bashpena Taptam. For that facility for double boiling, facility to take hot water bath. Hot water bath is a must or necessary to avoid the complication of Vasthi. Gas stove for making Vasthi, lighter and dining facilities. After Kashaya Vasthi, suddenly we have to give food for the person. So dining facilities should be available. Then diagnostic equipments for vital check. We usually check the vitals before and after doing Vasthi. Stethoscope, BP apparatus, thermometer. Protoscope is the very essential thing because the rectal examination is the must. Sterile gloves and masks, facilities for fermentation, facilities for hand wash, facilities for sterilization of equipments and utensils, cleaning material, lotion, soaps and hand wash, waste disposing bins as per color code. As per color code is described here as per NABH norms. Then IEC material. What is this IEC material? IEC materials are information, education and communication materials. Information should be effective, efficient measure for healthcare delivery. Patient and family member education about the procedure and the regimens following procedure is essential to make them confident. communication. Majority errors are due to improper communication. In our hospital, I am giving a written communication, because if I said one thing, there is chance for mishappenings, and therapist could not properly understand my language, or chances for complication. So written communication should be given. We are maintaining a ledger for communication and for avoiding errors of the procedure. Then procedure chart. It should be very clearly written. It should be self-explanatory, step-by-step description for therapist, nurse and doctor, for patient education. Diet to be taken before and after Vasthi. I gave an example. One patient take noodles instead of light vegetarian diet. If I should have written very clearly the name of the diet, the mistake should not have been happened. Clearly write do's and don'ts should be given. It should be given to the patient well in advance. These all matters, these all are easy material will help. These all materials are very helpful in avoiding errors during Vasthi. Incidences. There are some incidences which commonly occur due to the mannerism of the patient during the Vasthi. Patient suddenly raise the head, stop, and we ask the patient, please count or for synchronized breathing. But some of the patient suddenly raise the head and stop the counting. Then hindrance in entering Vasthi occurs. Keep the patient in a steady position to avoid these type of hindrance. The second one is evacuation before complete entering. This may be happen due to the patient error and therapist error, or the person doing Vasthi. It will spoil the cloth and table. At that time, give another Vasthi. Store excess amount of kalka and kashaya and other medicine to give another Vasthi immediately. This is Purva Karma of the Vasthi. Everybody knows. Purva Karma of Sneha Vasthi, Abhyangam, Ushnabhasnanam, take food before having Sneha Vasthi. 1/4 reduced part from regular quantity. Alpasnita mixed with the ghee, light hot food, like sufficient hot water before and after. Clear natural urges before doing Vasthi. Walk for a little time. This little time walking will facilitate the evacuation of flatulence, and it will facilitate the movements of gut movements properly. So little time walk before doing Sneha Vasthi is essential. Local Sneha Seda should be given, Kadi and Udara Pradesh. Position left lateral. Apply gently heated Sneha Devi at rectal area. Then I will describe about the procedure. Gently. This procedure is written by the experience of mine, not by the text. In the text also it is described like this, but I wrote what I am doing. Gently insert your index finger. The left hand is to be introduced. Feel the rectum free. Feel the rectum nicely. If there is any hindrance or if there is any mass, etc. Dilate it by tiny finger and gently forward the nostril over the surface of the finger. We can feel the nose of the nostril by a fingertip. Feel the nostril touching the tip of finger and turn the nostril parallel to spine. By doing this, we can avoid touching the nostril at the walls of the rectum and by causing wounds. Ensure that nostril placed in right manner. Then slowly remove the finger and ask the patient to open mouth and take respiration. Before doing Vasthi, the patient will be tightly hold his rectum. Please give maximum words. Please speak to him and pacify him, and then only apply and assure him there will be no harm. Then only perform the Vasthi. That is very good. The pressure applying, moderate pressure is needed for entry of liquid, not mild nor maximum. The vega in performing Vasthi or the speed in performing Vasthi should be moderate, not slow and not speedy. The Vasthi should not compress rectal wall, not give so much pressure on rectal wall and so much speed. Tighten and hold complete emptied part of the plastic bag for this for applying pressure. And for applying Vasthi for easy flow and application of uniform pressure, when sufficient quantity is entered, try to relax gluteal muscles. Gently and slowly pull out the nostril. We can watch bubbles entering the bag. When we started, we are not knowing whether the liquid is entering in the rectum. We can confirm the entry of the liquid towards the rectum by coming up with the bubbles into plastic bag or enema scan. While person is breathing, and just by confirm the entry. Pastat karma. For Sneha Vasthi, after doing Vasthi, ask the patient to lie down calmly in supine position for 100 seconds. This is needed for the spreading of the Vasthi virya in the entire body. Then, after 100 seconds, please do Tadana, Pidana over thigh muscle. In the case of Sneha Vasthi, we prefer retention of Sneha Vasthi. That is why we are giving Tadana and Pidana over thigh muscle. It should be done thrice at palmar, plantar, and thigh muscle. Wait peacefully for the urge. The maximum time for retention of Sneha Vasthi is about 9 hours. For Kashaya Vasthi, the Purva karma little bit difference. Take light food after passing urges. Normally, we are giving pal kanji mixed with the ghee or mixed with the mamsalasa or mixed with the mudke. The time madhyane kinjidavati. Doing locus snehasvedam kadiyudara pradesham. Apply sneha in rectal area. Position should be left lateral. Procedure of doing Vasthi is same as Sneha Vasthi. Kashaya Vasthi, the Pastat karma. Ask the patient to lie down calmly after the Vasthi with pillow under his head till the urge. Try to hold for maximum time, but do not forcibly. If the urge comes, it should be expelled. After defecation, take rice water. Here you should concentrate. We have performed the Kashaya Vasthi. After defecation, soon after, the patient feels the energy loss. The Kashaya Vasthi is Niruha Vasthi. It has Uhadida, Virya, and Prabhava. Here you should carefully give him water. Do not allow the patient to lock the bathroom. A patient or bystander should be with him for watching. Then please give Laja Manda or Kani. Patient will be very tired at that time. Then hot water bath is needed. Hot water bath is essential. It will reduce the complications of the Vasthi and have food with proper Udamsa. If we are forcing the patient to take food at that time without giving paya, laja, without paying rice water or laja manda, we will not be able to take sufficient or enough diet. He will have hesitation. He will be in a dilemma with the colic pains, and he wants to go frequently into bathroom. In between the having meals, he will be in complete discomfort. So please give rice water or laja manda. Not give the food forcibly. After having bath, please comfortably have his meals. Points to be taken care or while administering Vasthi. Ensure that the nozzle is made for the smooth entry. It is with oil, and the dravya. The second one is dravya should be thoroughly mixed. If the dravya is not mixed, the entry will be delayed. It should be in colloidal form. No sediment particles causing tube blockage. Tube blockage is a common problem. At first, we check the tube blockage. The entry is open. In the middle, the tube will be blockaged if the kalka is fine, and the chance of blockage of Vasthi nozzle and tube by this kalka particle. If this condition occurs, please filter the mixture again. At that time, please watch the temperature. It should not, by the filtration, the dravya, the temperature of dravya should not be coming down. Keep the mixture in optimum temperature. Do not dip the finger for testing the temperature. Pour a little mixture on palm and feel the temperature. Do not use mixture which is cold. It will cause fever, stabdhata, pain, etc. Keep an additional baggage. Normally, we are using a double baggages as the container of Vasthi dravya. Then there is a lot of cases or chance, and there is chances of breaking. Once I said that the pressure should be applied is moderate. Some people applying more pressure and pushes the Vasthi forcibly, then there is the container is breaking. Points to be taken care while administering Vasthi. If we are using an enema can, it should be placed at a height above the level of head to give optimum pressure. Use aptus used to prevent tube blockage. Maximum care to prevent air bubble entry. Before and after, we should prevent the air bubble entry to aquasia. Before the procedure, for this, let some quantity to flow out and hold tightly by covering nozzle with finger to prevent air entry. At the end part, allow a small quantity to remain. It can prevent the air entry. Usage of mask, mask is is always good. Shield is also very good to avoid the offensive smell coming out from a rectum. With the mask and shield, we can have a close watch to the rectal side. Keep a safe position soon after administration of Vasthi to avoid spilling your face and cloth. There is a chances of reverse flow in some cases. If a reverse flow will occur, there is chance for spillage of cloth and face. These are the changes seen in the patient during Vasthi. This is what I have observed. During and after administration of the Vasthi, the nadi will be feeble. The eyes will be looking tired and shady without brightness. The Vasthi dravya is retained. We can confirm it by looking into the patient eyes. It will not be bright. Changes seen in patient after evacuation is eyes look bright. Nadis are in full volume, full tension, and it will be in rhythmic manner. Pathya. In Kashaya Vasthi, daytime sleep should be avoided. Daytime sleep promotes kapha and indigestion. Avoid footsteps causing indigestion. Kalaya, pulses, upama, bread, etc. When given, and these are causing problems. Sneha Vasthi. Avoid daytime sleep. Avoid drinking cold water. Guru, Abshandi, Vidahi, and Snana. Paya is also denied due to kapha. There are different Vasthis, different yogas, and different medicines. Medicines required for concerned Vasthi should and kept ready. Assess the standard of these medicines for getting good results. Kashaya and Kalka in excess should be stored. It is not easy to prepare Kashaya suddenly. So, excess amount of Kashaya. If we are giving 600 ml of Kashaya, we are preparing 1 liter or above Kashayas, and it should be stored. Likewise, Kalka also stored in excess to give an immediate Vasthi if spillage or no entry not entering full amount. In that cases, we should give another Vasthi immediately. Most important, mixing of Vasthi. Once I said that use large mortar and pestle. In our hospital, there is 1 liter capacity of mortar and pestles are using. Everybody knows the general rules. Makshigam, Saindavam, Sneham, Kalkam, Kwatham idikramal, Avavede Niluhana, Esha Samyojana Viti. For Snehasti, we are using a small pinch of Saindava and Mishi as additional trivias. Kalkam, fine paste to avoid nostril blockage. Pour the mixture in vessel and place in double boiling unit after mixing. Keeping the mixture in steam and using kadagod. Ushnambukumbi bashprena taptam. That is the process. Or other ways, we transfer the mixture after mixing up to mixture and mix it and to be placed in steam, maintain the optimum temperature for administration. We are using mixie and this mortar and pestle. First mixing is done at mortar and pestle. Then we are using kadagol instead of mixie. In the case of we are using mixie, we are also mixing the Vasthi in that pestle and transferring the mixture to mixie and then to Ushnambombi. Food and drinks to be given immediately. After Kashaya Vasthi, once I said rice water, Kanyi Vellam in Malayalam, Lajamandam, rice and suitable Ubadamshas according to dosha, Mutkayusha, then Mamsarasa, then milk or palkani, these are given. We are giving boiled water only for drinking. Boiled water, saturated, boiled with dhanyaka, ginger, etc. Sneha, dietary restriction. Food should be immediately given in Kashaya Vasthi, Sneha Vasthi immediately after diet before trying. About Uttara Vasthi. We can perform, surely perform Uttara Vasthi in OP, but it needs special skill. It needs special equipments in an aseptic condition. This Uttara Vasthi is practiced by experts. Have witnessed the practice of Uttara Vasthi in our OP by Dr. Ina Divagaran, and I have witnessed Uttara Vasthi in OP at Ayurveda College, Udupi, but I don't do like this because I lack this expertise. The list of essential medicines. These are the essential medicines to be stored to overcome the complications, if any. Dhanyandaram Guliga. Usually the Dhanyandaram Guliga is needed. It brings Vadanilomana if anything will happen. This Vilvadilehim, it is very good for arresting the diarrhea, etc. Vilvadi Guliga is also for using arresting diarrhea, Pichasravana, etc. Partharishtam, it is used in Vastis when during Brahma, low pressure, etc. Kudajarishtam, it is also used to overcome diarrhea. Siddha Magaradija is also given to prevent cardiac arrest and cardiac problem, etc. Akshashari Guliga is used in diarrhea. Dadimadi Churnam is used in diarrhea. Honey is good for giving arresting diarrhea, and is the protein full diet also. Saindava salt immediately doing Vasthi. Laja for making Laja Mandam. In any case, if rice or rice soup is available, we are giving Laja or Laja Kanyi for the patients. And we can immediately make this Laja, and it is Tarpana also. And it is very good for the Urjakshaya of patient. Kshira Bala Avarti. This Kshira Bala Avarti is used when the Vasthi, retention of Vasthi occurs. We are applying this Kshira Bala Avarti in lower umbilical region and giving fermentation to overcome the retention of Vasthi. Dasnadi Churnam. After bath, we are using Dasnadi Churnam to prevent Nirdosham. Vaishwanda Churnam is very helpful to overcome the retention. We are using it abundantly mixed with Gomutra or Dhanyamla. Gomutra, we are using, is an essential thing to overcome this retention. We are using sterile Gomutra for sterility. We are boiling it. Dhanyamla also is essential for overcoming, and Dhanyamla is used to give for Tishnavasti. Gomutra is also using for giving Tishnavasti. Then the next, this is Anubhava series, and the sharing of experience is starting. I have done numerous Vasthis in OP and IP. Own combinations also done. I obtained remarkable positive changes in curing and management of ailments. Met with few complications. No death has been occurred. These complications are countable with a finger. The one is due to improper diet after Kashaya Vasthi. I have told, took vegetable noodles, a slight hot diet, and do not repeating, and gastric disturbance, overcome is Mahadanandal tablet and Varogashayam, put order by, and patient is completely recovered. Vasthi in diabetic gangrene with previous history of stroke and wet gangrene. Vasthi is contraindicated in Madhumeha, but by giving proper medicine and controlling Madhumeha, I give Vasthi in diabetic gangrene. 7 days, Panchadiktaka Kshira Vasthi. I performed with 7 days, Yabana Vasthi, Panchadiktaka Kshira Vasthi. Gulguludikta and Kridam is used at the stand of Sneha, honey, Saindavam, Avibhati Churnam as Kalka, gangrene cured without amputation. Vasthi in psoriasis. In this case also, in psoriasis, it is coming under Dedri Gushta, Sitma Gushta, Ega Gushta, Kapala Gushta. We can compare psoriasis to these type of Gushtas. And in psoriasis and Kushta, Anvasana Vasthi is delayed. As per some text, Astabana Vasthi is also delayed. Some advices to given Astabana Vasthi. Anyhow, I give Astabana Vasthi. It was the need of the patient. Astabana Vasthi was done with Aryagudadikana Kashayam, Aryagada Mahadikta Kridam, honey, Shadahwa, Saindavam. The Vasthi Yabana Vasthi for 7 days. Complete cure of psoriasis. No recurrence till date. The patient is in still contact with me. It was done in 2001. After the Kashaya Vasthi, I gave him Matusnuhi Rasayanam for the best recurrence, for the best cure. Deep vein thrombosis. These types of diagnoses are not available in our textbooks, but this is a common problem nowadays. I have administered Yoga Vasthi in 2001 in deep vein thrombosis. He was on anticoagulant taken for the past 7 years. Warfarin was the medicine. He was a 29-year-old male patient. Now he is in Ireland. I give Madhudeliya Vasthi, Erandamuladi Kashayam, Madanaphalam, Gulguludikta Kridam, honey, Saindam and Shadaguppa. Follow up till date, no recurrence. He has stopped warfarin. There is no medicine going on. The medicine combined with this was Shuddha Gulgulu tablet of Himalaya, and I give Dhara in this case also. Vasthi in Vadaraktam. Most often the people are doing Vasthi in Vadaraktam. It gives a good result also. In 1992, I give Bela Gulichadi Vasthi for bedridden cases. These people are bedridden for 3 or 4 days. After instating the modern medicine, there was no use. I give this Bela Gulichadi Vasthi along with this Phaladaga Rasayanam. Till date, no recurrence. Patients are in contact with me now also. It was done at 1992. This was done with done as IP patient, but I exchanged this for the sake of knowledge. This is my own yoga. In Kadi Graham, acute lumbago, sciatica, I get good relief with this yoga. This is easy for the preparation. Gandharvastadi Kashaya. I am taking Gandharvastadi Kashaya and preparing this Gandharvastadi Kashaya with Gandharvasta Churna using Kalkamas Hingojadi Churna, using Malankarika, Kalyana Ksharam, Gulgulodikta Kridam, Thailam, honey, etc. Immediate relief. So many people are approaching us with acute lumbago and sciatica. All these people are coming with the help of one. They are not able to work. After attaining Vasthi and Chinja Levana Sedam, they are able to walk with a remarkable difference. This is a case of infertility, unexplained infertility. These are doctor couple. After 8 years of marriage life, they had no children. OP level Vasthi. Within 2 months, conceived. Vajigarna Vasthi in male using Tippali, Ikshurasa, Vastyamanda Krida in the place of Sneha and Sneha. In this case, 25 grams of Tippali powder is used as Kalka. It was a Pitta predominant person, but to reduce the complication, I added Ikshurasa in double Ikshurasa in double quantity. Then also after 5 days, red type rashes developed. The food given was palkani, 3 times palkani for this Pitta predominant doctor patient. Then Lekhana Vasthi for his wife, doctor. Tripilakadham, Ushagadi Pradivavam, and Kalyana Kridam was used. After 2 months, they got conceived and they had a female child, age 2 years. In this side, I have written about the complications I faced. I have faced the diarrhea as a complication. I performed a Kashaya Vasthi with fresh Erenda Mula. The Vasthi was Madhu Dailiga. Drug was easily available at hospital premises. It was an Anubhava. I take this Erenda Mula, fresh Erenda Mula. It was fleshy to make Kashaya. Madhu Dailiga Vasthi was administered for 2 patients at the same period. Drastic purgation started. Managed with the Dahadi Mashtaka, Villuadilehim, Lajamanda, and Kudajarishta. Within 2 hours, we arrested the diarrhea and the patient recovered. This is another complication. The patient became unconscious. The patient was little hungry. She was of Pitta Pragati. She is now 56 years old. I done this Vasthi in 2000 at Changanasheri. After Kashaya Vasthi, Madhu Dailigam, done at 1 p.m. At that time, I was busy and there was 2 or more Vasthi has to be done. This was the last patient. After having Vasthi, suddenly Riker started, unconsciousness. Even her hair began to rise up. It was straightened. In Malayalam, Vadi Pole Pungin. Patient had the history of getting unconscious when hungry, but it was not revealed. That is why I stress the importance of case taking and associated complaints, etc., and habits, etc. We give Partharishtam with the Siddha Magaratajam immediately and have a hot water bath, Lajamanda, proper food. The patient recovered completely. Then another history of retention of Kashaya Vasthi for 48 minutes. We gave Kashaya Vasthi and I went to OP. The nurse complained me that the Vasthi has returned after 30 minutes. For 30 minutes, we wait for expulsion. After 30 minutes, we started Sneha Sweda, applied Shirabala. During this time, prepared another Vasthi with Gomutra and Vaishajala Churna and gave after 48 minutes. Remember, Agado Paramakalo Mupurta Mrityu. The first Muhurta is not for the death. The second also not having death, but we should The second muhurta is the karma, the third muhurta is the karma kala. Then we should act fastly, and we give Gomutra and Vaishanda Churnam. After 48 minutes, after they were released, patient was comfortable. Spillage of Snehasti after 4 hours on doorsteps of house. This was an OP case. The patient was a woman, aged 75 years. She had her evacuation of Sneha after 3 hours. Then she is discharged after 4 hours observation. Even then chances of residual discharge, this is the indication. She went home by own car, and reaching the doorstep, there was spillage and another urge. If Snehasti did not came out, journey will be uncomfortable. That is why I insisted that do not use public vehicle. Please use diaper like objects to prevent this type of inconveniences. Then OP level Vasthis. This is another type of Vasthi not mentioned in our textbooks. In Amavada, rheumatism, we are applying Churna Vasthi. What is the difference between Churna Vasthi and Kashaya Vasthi? Churna Vasthi does not contain the ingredients Thailam, Sneham, etc. Only Churna, Kashayam, sometimes Saindava and Jagari is added, but it has a fast action. Gandharva Hastadi Katha, Jagari, Saindava, this type, using these 3 ingredients, Vasthi is performed in acute Kadigraha with very good result. Dhanyamla and Saindava also used for performing in this type of Vasthi in Kadigraha. It is also gives very good result. Kshira Vasthi. In Panchadikta and Kashaya Vasthi is a good combination. We are making Kashaya with the Panchadikta and using Kalka as using Avibhati Churnam as Kalka. It also has very good result. Then Vaidarna Vasthi is the most familiar Vasthi in our hospitals. Matadailiya Vasthi, Belagulichadi Vasthi, Yoga Vasthi, Sneha Vasthi, Matra Vasthi, Uttara Vasthi. These all Vasthis are very well practiced in various hospitals and OP centers also. Then coming to the conclusion, yes, we can perform OP level Vasthi easily, provided we take more care, precautions, adhere to guidelines, and with the teamwork. About Kashaya Vasthi, it is easy to do. Please discharge patient after 3 hours to avoid further complication. And insist on food restrictions and their viharas also. About Sneha Vasthi, retention period is higher. Journey can cause discomfort, and the safest mode of travel should be obtained. Make necessary arrangements. Remember, the action of Vasthi is quick and sudden. Patient will get sudden relief. About these Vasthis, as a part of conclusion, it is the need of the hour and can create more confidence for Ayurveda in mind of the people. Thank you, Dr. Jesul, Team Ayurveda Map, Dr. Anila, and Dr. A.P. Alikuti's Kottakkal Ayurveda Pharmacy, and to my team Unnithan. And special thanks to Dr. Lesida Sanel and Dr. Sharanya Regin for Sanskrit typing and their good suggestions.
Thank you, ma'am. Thank you so much. Thank you so much for this very informative and enlightening session. Before going to the discussion, I would like to invite one of our sponsor, Dr. Muhammad Yasin. He is the factory in charge of Dr. P. Alikuti Kottakkal Ayurveda Pharmacy. I would like to invite him for a few words.
Hello, Dr. Yasin. Hello. Hello, doctor.
Hello.
Yes.
Hi, good session regarding an important session in Ayurveda Vasthi. I need only 5 minutes to introduce our product. I'm talking on behalf of Dr. P. Alikutis Kottakkal Ayurveda Pharmacy, Kottakkal. We have almost all regular production is there on classical segment, as well as around 25 products, patent products also there. We majorly looking forward doctors, practicing doctors, and our classical segment almost all yogas means Sahasra Yoga reference all we are preparing. That means if the doctors are needing for quantity medicine for their normal practice, we are specifically manufacturing those products and we will deliver to their own places. And also I take this chances to describe regarding the Vasthi related some products. Our that means Vasthi related, that means above, that means Grida and Taila. In Taila, almost all the yoga in Melgu Paga available. That means in Vasthi Paga available, as well as the instrument regarding Vasthi procedure. Disposable syringe is there. That disposable syringe is manufactured as that syringe is flexible for Snehavasti purpose. That syringe is associated with one more pair nozzle also there. That one also flexible one. That disposable syringe having user friendly at the same time for doctors purposes. That means our practicing doctors. Madam is also describing that OP level treatment. For that doctors, we are giving very favorable rate. And the other one is Kashayavasti syringes. That Kashayavasti syringe is also disposable. For those products, you please may contact with Dr. Jasul or to our company also. Okay, thank you for talking or conversation with all the practicing doctors. Thank you for.
Thank you, sir. Thank you very much.
Thank you, doctor. Now we will start the discussions. Those participants who wish to ask any queries can ask their queries in the chat box. We can discuss. For the samples of Vasthi syringes and all, you can contact Dr. Jasul further.
Okay, ma'am, regarding the acute pain management, how Vasthi, you already mentioned it. How extent what are the indications for this acute pain management?
Doctor, am I audible?
Yes, ma'am.
I'm performing Vasthi in acute Kadigraha. Acute Kadigraha, sciatica and lumbago. It will give good results. Vasthi. Kadigraha, lumbago, and sciatica are related to Pakwashi, and these three are the other yogas, and we are getting good result after expulsion of feces and after expulsion of doshas. Suddenly we are getting the patient coming with the help of the bystander is able to walk without any help. That much result. We are using pulling your Chinja Lavanaseda a treatment we are using at our hospital. Along with this Vasthi, by these two, we are able to manage these acute pain cases.
Thank you, ma'am. Ma'am, what is the role of Vasthi in Pakshagada?
I have done Vasthi in Paksha, a lot of Vasthi in Paksha Khada. After giving Vasthi, you will be able to walk. That the result, I got the result.
Ma'am, any
In
specific
Paksha Khada,
any specific formulations for that?
we are giving Mathadeli Vasthi. Mathadeli Vasthi mostly in our hospitals.
Okay, ma'am. Ma'am, why Madhumeha is contraindicated? Ma'am, nowadays most of them are having diabetes, but still we are giving, without even thinking about that, we are giving Vasthi for diabetes patient. Why it may be contraindicated, ma'am?
It is contraindicated in our text also. In Madhumeha, there is chance of Ulkleshana.
Okay, ma'am.
That way I am thinking the Vasthi is contraindicated. But in my practice, I am giving lot of Vasthi in Madhumeha cases after controlling Madhumeha. I have given Vasthi in patients who are using insulin also. And I have shared an experience who is having Madhumeha. The RBS was of 375 milligram per deciliter, etc. And I gave Kiratikta and Kashayam along with Chandraprabha, and it was reduced to 125 milligram per deciliter, and then I gave Vasthi. It was miraculous effect in that case, because 3 of the fingers were blackish in color and immense pain and edema was on that leg. All type of pain was reduced. Panchadikta Kashaya Vasthi, which I was used. Rasa Ganthi Mediga along with the Rasa Sinduram also have given. But the Vasthi produced the result. I firstly administered Dhara, then Uddhartanam, but not so I was not getting so much result. After administering Vasthi only, I got the result. The disease was controlled.
Okay, ma'am. Ma'am, one query is your experience of Vasthi in heart disease, especially coronary artery blockage, ma'am.
I am not giving Vasthi in coronary artery disease. Only practicing Udara Vasthi and medicines, not giving Vasthi.
Okay, ma'am.
Because I am fearful of the risk.
Okay, ma'am. Ma'am, explain Matra Vasthi in sciatica and how many days and how much quantity in your experience?
Matra Vasthi, we are giving 60 ml of Matra Vasthi for 7 days, getting good result in sciatica.
Okay.
Sahajaradi Thailam Mediga, and we are using Sahajaradi Thailam Medigubhagam and Thanandaran Thailam Medigubhagam.
Okay, ma'am. There is another query, ma'am. Can we give Vasthi in children suffering from constipation, worm condition, etc.? What will be the dosage and ingredients? And what will be the approximate size of syringe? At
first, we are giving mild laxatives. Then we are giving, not using Vasthi Andhra, syringe with the cannula is using, giving glycerin or Nimbamadadi or Gandharva erandam, less than 30 ml. And Avagaha Seda also is giving for the fast relief. Okay, not Vasthi Andhra, syringe with the cannula or veterinary syringe.
Okay, ma'am. Ma'am, whether you have used any Vasthi for insomnia in elderly patients, ma'am?
Not used. Talam, I am using Talam. But I have done Vasthi with Matra Vasthi with this Gandharva Hastadi Eranda. It was a trial, but not much result I got.
Okay. Ma'am, for menopause, any Vasthi, whether you have used or which Vasthi?
Not at all. Not at all used. Menopause Kanashadahadi Kashayam. We are conducting blood tests, and after giving, if it is not menopause, giving Sadavari, Saptasarang Kashayam, Kanashadahadi Kashayam, etc. And we are getting good result. No Vasthi has been done so far.
Ma'am, in IVDP cases of cervical spine, role of Vasthi than Nasya?
In IVDP cases, I am giving Nasya with Nirgundi Sarasa. Nirgundi Sarasa. Avapitaga Nasya is the best in IVDP cases of cervical spondylosis. In lumbar spondylosis, There is a good role for Virechana and Vasthi.
Okay, ma'am. Ma'am, vitamin D deficiency, any Vasthi given or?
No, I am using Guruji Sattva, and one case she cannot be given vitamin D supplement. Then I give Guruji Sattva with Gendha Taila for 3 months.
Okay,
Then I
ma'am.
get desired result.
Ma'am, neurological problems, which Vasthi can be used?
According to the neurological problem, Rajayabana Vasti, Madhudelika Vasti, etc. can be used. I am using Uddhartanam with Uddhartanam, Sniktha Uddhartanam using butter. It is best for neurological cases at the first stage, not Abhyanga.
Ma'am, Avagaha bath for children, what drugs effective for immediate results in constipation?
Dashamulam, we are using Dashamulam or Trifalaquadam.
Okay, ma'am. Gallbladder stones, can Vasthi be used?
Never used. It will cause colic pain.
Okay, ma'am.
Chances for coming out of the stone. I am not using Vasthi, medicinal practice. Pittor, I got best result with the Pittorin, then Pittorin tablet of Immis and Stonex and Punarnavadi Kashayam and Chavikaso with the Kasturiadi. That is giving.
Ma'am, can Vasthi be used in inflammatory case suddenly? Immediately we can start with Vasthi, or do we need to go for settle the inflammation first and then do the Vasthi?
In
Inflammation.
Inflammatory cases,
Mm-hmm.
inflammatory cases, mostly in Vadarakta, we are selecting Churna Vasti. Churna Vasti is best for reducing Ama Vasta. In inflammation, there will be Ama. If the tongue will be coated, densely coated, in that condition, we are using Amrdottaram Kashaya. There will be fever also. In that condition, we are using Amrdottaram Kashaya plus Sudarshana Churna. 500 ml of Amrdottaram Kashaya, 15 grams of Sudarshana Churna, little bit Saindava Namak, or with the Jagari, or otherwise with the Amrdottaram Kashayam Shadharna for consecutively 3 days with excellent result.
Ma'am, role of Vasthi in grade 3 osteoarthritis, severe knee swelling.
Oh, in osteoarthritis, we are not using Vasthi, but Snehavasti will helps to bend the knees. We are using local application, Sniktha Uddhatanam, Dhara, medicines, and Snehavasti will get, or Matravasti will help a lot in bending the knees and reducing the stiffness of the muscle.
Okay, ma'am. Any Vasthi for breast fibroadenoma?
Not using.
Ma'am, for hypertension, if the patient is hypertensive, can we suggest Vasthi if he is into drugs?
We should take precaution. We should take measures to make it to a normal level. After that, we can do the Vasthi. Nowadays, plenty of comorbidities are there. So we are trying to make it normal.
Okay. Ma'am, any Vasthi for tuberculosis?
We are not treating tuberculosis because it is a notifiable disease. It is an offense that Ayurveda doctors are treating tuberculosis. That is why I am not treating tuberculosis. We are able to treat tuberculosis.
Ma'am, Vasthi in irritable bowel diseases.
Ichavasti. There was a case. He came from Africa. There was a history of insect bite, and he underwent the coma. Over the phone, I gave him Vilwadi Guliga, and it was couriered to Central Africa. After that, he came back. He was very thin, feeble, no appetite. Then I gave Ichavasti 7 days with excellent result. The patient recovered very fastly, and And he went to Africa, Central Africa. He was a priest.
Okay, ma'am. Ma'am, everybody is asking for Churna Basti dosage.
Churna Basti, 500 ml of kashaya, 15 gram of Saindava salt, 15 gram of Vaishwanda churna.
Okay.
5 grams of Saindava salt, 15 grams of Vaishwanda churna. Boiling and filtering, and then giving Vasti at optimum temperature.
Okay, ma'am. Ma'am, PCOD and Vasti.
PCOD, I have not tried Vasti, giving medicines only. For the PCOD, it is best to conduct Vamana for the amenorrhea. After conducting Vamana, soon she will menstruate. Sadhya Vamana also good. Classical Vamana is very good for PCOD. Pradiloma Shodhana. Vamana is the Pradiloma Shodhana method. Vamana will help to correct the hypothalamo, pituitary, ovarian axis.
Ma'am, Pichavasti Yoga, please explain.
I will send it later.
Okay, ma'am.
Not available with me.
Okay, ma'am.
Textile yoga. Pichavasti.
Ma'am,
It
Crohn's
was done
disease.
in 2012. Yoga is not with me.
Okay, ma'am. Crohn's disease, any Vasti?
No, I have not tried. It is a chronic inflammatory disease. I think the Vasti will be contraindicated in that condition. Only use mild things. Medium Vasti has Vasti is very potent. Do not use such type of things in Crohn's disease. That is my opinion.
Okay, ma'am. Now, if any participants who wish to ask any queries, they can unmute or they can raise their hands. We will unmute. If anybody wants to ask directly, they can ask.
There's a question, liver cancer. Vasti is contraindicated in Udara Rogas. Please do not try Vasti. It will produce severe rectal bleeding in liver cancer. I'm treating liver cancers, but not doing Vasti. I'm giving medicines, certain kanyis, and Ajayakrit yoga. Ajayakrit should be prepared, boiled in Bringaraja Swarasa and fried, and I am giving this. And the Hamsavadi Kanyi, Drona Bushpi Kanyi, Vasha Guluchadi Kashayam, Vilvadi Kashayam, etc. But never doing Vasti in liver cancer. There is chance of bleeding. That is why I am not doing perrectal bleed. There's a question here.
Okay, ma'am.
In renal cyst also, I am not doing Vasti. I think that it will be not such effective in renal cyst. I am giving this Shilajadu with the Triphala Kashaya in renal cyst. How to do Sadhyavamana? Sadhyavamana. Any precautions in Sadhyavamana? Any precautions in Sadhyavamana? You should take an ECG. After that, if Ulklesha is present, Tatra Ulkrishte, Samulkrishte, Kapapraye, Chalemale. That is the condition. This is the sloga from that Jora chapter. In that condition, if already Ulklesham is present, we can administer Sadhyavamana. There is a question regarding that. That is why I answered.
And preventive aspect of stroke.
Well manage the comorbidities. Well manage the comorbidities. That is the preventive act. Should practice a healthy lifestyle. And frequent health checkups should be conducted. That is the preventive act. Healthy lifestyle. That is the basic. Exercise is also important. Exercise, yoga, proper dietary habits, proper walking, proper sleep, etc. etc.
Have any queries, please write in the chat box. Or you can
Amavada, there's a question that Amavada Vasti. Churna Vasti, Amradotaram Kashayam, either Sudarsana Churna or Vaishanya Churna with a pinch of Saindava salt. And if needed, Jaggery also has to be added. In Amavada, we are conducting Churna Vasti for consecutively 3 days. And after that, Shadahva Seda, Ushma Seda. Then the patient will be relieved.
for allergic dry cough, any Vasthi, ma'am?
Was not administrating Vasti. For allergic dry cough, Vamana and Sadhya Vamana and Vamana, classical Vamana conducting and giving Krimiknavadi, Krimishodhini, Yoshadi Vadagam, Nano Kopuni, Haridrahanda, etc. etc. Imperajinadi, etc.
Please explain Vaitarana Vasthi, ma'am.
Vaitarana Vasti is a Shara Vasti. It is from Phela Samhita. Chinja, Sharkara, Gomutra, Dhanyamla, milk. These are the ingredients. Chinja sarsam is taken. One day Dhanyamla is added. Other day we are using milk instead of Dhanyamla. These are the ingredients.
Why
Xylem is also added. Saindava is also added.
Okay. Why Jaggery is used instead of honey, ma'am?
Honey. And Chinja at the place of Kashaya.
Psoriasis case, Astabana Vasthi done continuously or as Yoga Vasthi?
Not Yapana Vasti for 7 days. In psoriasis, Anuvasana Vasti is contraindicated. So I conducted Yapana Vasti 7 days consecutively.
Okay, ma'am.
Good evening, madam. Thank you for the wonderful lecture. Madam, my query is that as you explained that Dhanyamla can be given in the Kati Griha, so whether the Dhanyamla will not cause the much irritation of the Pakwasa?
I have no experience like that. We are giving Dhanyamla with Saindava Namak. Not faced any type of complications.
So diluted
In
Dhanyamla,
Kati Griha,
you are doing dilution or as it is?
not diluting. Dhanyamla as such. But I am giving Dhanyamla of Aushadhi. Aushadhi with Saindava Namak for intake in Kadigraha conditions. In persons who had spinal canal diameter 4.6 millimeter, etc. This Dhanyamla Prayoga gives good result. Intake of Dhanyamla. And the Vasti of Dhanyamla also will give, also gives good result. I did not face any irritation.
And madam, quantity for the intake and Anupan?
Dhanyamla 30 ml plus Saindava Namak plus pepper, a pinch.
Kali Mirch, no?
Yes.
Kali Mirch.
Okay, no, thank you.
For 14 days.
Okay.
Ma'am, role of Vasthi in antibiotic resistant recurrent UTI.
In recurrent UTI, we are using Avagaha Swedam. Then searching for stone or any underlying reason, etc. etc. And not using Vasti. Giving Shadavari Gulam and Vastyama and their Krudam for avoiding recurrence. No Vastis has to be.
Any further questions? Psoriasis medicine and Yapana Vasthi, ma'am. Psoriasis medicine in Yapana Vasthi.
Written. Ayurveda Kashayam. In place of Kashaya, Gulkurudikta Kridam, honey, Saindava, Madanapani. Put it. In the place of Kashaya, Aryagvadadi Ganam Kashaya. Vulkiladikta Kridam in place of Sneha. Honey was used, Madanaphalam was used, Saindava was used. Aryagvadadi Kashayam, honey, Shadahwa, Aryagvada Mahadikta Kridam or Gulgulodikta Kridam, and Saindavanam.
Okay, ma'am. Any further questions? If anybody wants to talk, they can also raise your hands.
Okay, Dr. Anila, thank you. Before that, I invite Dr. P. Rahmatullah sir from Kottakkal Ayurveda Pharmacy. Welcome you, sir.
Thank you. Good evening, everybody. Thanks, Dr. Unnithan, for your practical experience sharing class. This is very effective to all of the audience, I believe. This also they have inspiration to start the doing the practical Vasthi in their clinical practices. Thank you for all your sharing of knowledge. And I believe you know me. I am my brother, Dr. Abdul Ghaffur. I believe you're junior in the Toronto Ayurveda College. Okay. Thanks, all of audience and Dr.
I know him
for this Anubhava session. And thank you to all also audience. Thanks. Good night.
Thank you, Dr. Rahmatullah, for your presence and also speaking few words, and also for sponsoring all these Anubhava series, Doctor. Thank you. Yeah, over to you, Dr. Anila.
Thank you, sir, and thank you, Jaswal. Now, all of you can give us your feedbacks. You can either write in the chat box or you can speak. After that, we can wind up the session. Anybody wish to speak, they can raise your hands or you can write it in the chat box, your experience, everything.
Madam, there is 2 questions in chat box. Vamana and Sadyavamana is very effective in psoriasis. That is my experience.
Yes, doctor. Yes, you can continue.
Yeah.
Hello.
Hello. Hello, ma'am.
There is 3 questions in chat box.
Yeah, ma'am. Dark circles, any effective medications, ma'am?
I have not treated in dark circles. In the case of anaphylactic shock, there is a question regarding anaphylactic shock. In the case of anaphylactic shock, acute management cannot be done with us. I am sending, I have this experience. I am sending this to modern medicine, and the later phase was managed by us. We are not able to manage this acute condition. That is my belief.
Okay. So anyone can just unmute and have your feedbacks. Okay. Or
there's another question.
Yes.
Which talam in insomnia for elders? I'm using Ksheeravala talam, Tannandaran Dailam talam, Velagulichadi talam, Bela ashwagandha talam or nellikka talam hair package. This is excellent for insomnia.
Okay, ma'am. Thank you. Hope we are done with the discussion. Is there any further questions?
Hello.
Yes, ma'am.
Yeah. Thank you ma'am for the very nice session. And it was a very nice one. Ma'am has explained quite in detail related to all cases. So
Thank you.
it was
Thank
great.
you, doctor.
Thank you for organizing this.
Thank you.
It was a very wonderful session, Dr. Rathi Unnithan, and we are very happy to listen to your experiences as the current time need more comprehensive practices of our Kriya Kramas, like in an OPD levels. And it was very eye-opening to listen to you, as well as your experiences on Churna Vasthi and different combinations you create according to the condition, rather sticking into the old style of doing the procedures. And it was quite good to know that you use Dhanyamlam as an internal medicine. This is the first time I am hearing from someone's mouth that this can be used in IVDP as an internal medicine. That's quite catching. And I'm going to use it because as a practitioner of quality treatment, we get a lot of IVDP. We have our own practice methodologies, but this is a good tip or a good eye-opening to know that Dhanyamlam can be used internally. And I just want to ask, can we use the Dhanyamlam internally along with the decoctions like Gandharva Hastadi Kashayam, etc., or it is better to use as such?
Dr. Lal Krishnan,
Yeah.
It is a true experience. I am doing this frequently. I am giving Dhanyamla after meals or after food. 30 ml of Dhanyamla twice daily with Kali Mirchi and Saindava Namak for 14 days. It gives very good result. Actually, the Dhanyamla Aushadhi is prepared for internal use, but they are denoting only for external use. That is the only problem I am facing. You should make Dhanyamlam with a proper cleansing of these materials. Most people making Dhanyamlam without washing, etc., etc. Purified drugs should be used to make Dhanyamlam. It will give very sure result to you. Happy to see you.
Thank you, sir, and thank you, ma'am.
I'm using Dhanyamla alone, not mixing with Gandharvasadi Kashaya. And initiating after diet only. I'm giving Kashayams before diet. Normally I am. Rasonadi Kashayam is giving after diet. Ashtavarga, etc., etc. for Urthagadaba.
Okay, ma'am. Anyone else? Anyone else would like to speak? Thank you. Thank you so much. So I think we can wind up the session. Thank you all for the feedback. Yes, Dr. Babita.
Yes, thank you all, and thank you all for your feedbacks in the chat also. Thank you. Yes, thank you, ma'am, for your wonderful and very experienced sharing session. Okay, we can surely see later. Okay, in our another sessions. Okay, thank you, Dr. Anila.
Thank you. Let's leave.
Good.
Good night.